Hi there, I'm Dr. Christine Stewart at Adynoplastic Surgery, and today I'd like to talk to you about our 7 most common questions that we get regarding recovery after a mommy makeover. Now, if you haven't seen my first video, which is the who, what, and when of mommy makeovers, I suggest you go back and watch that first. It just provides some helpful context for this video. So let's jump right in. The first thing people want to know about a mommy makeover is it a same-day surgery or is it an inpatient surgery? Because it seems like a lot of surgery. And it is, depending upon what you're having done. You could be under general anesthetic from anywhere from 3 to 6 hours. 99% of the time at a adynoplastic surgery, a mommy makeover is an outpatient surgery or a same-day surgery. The surgeries are done in our surgery center. We are a Quad ASF certified surgery center, and you do want to look for that if you are having a surgery in a surgery center that's not affiliated with a major hospital. Basically, the Quad ASF is a governing body in the United States that makes sure that independent surgery centers are meeting certain safety and quality recommendations. So the surgery is done in our surgery center, and then you'll recover in our post-operative recovery room, and then you'll need someone to drive you home. So what about the 1% of the time when you need to be admitted to the hospital? Well, luckily for us, we're connected to Fairview Southdale Hospital via an underground tunnel, and so logistically, it's fairly easy for us to admit someone if we feel that it's medically necessary to do so. So what patients typically get admitted, because it is pretty rare? The most common cause is postoperative nausea and vomiting after surgery. Likely you'll know if you're prone to this because if you've had any other surgery before and you've had this issue, that'll be something that you'll want to let us know about beforehand. There are certain medications that we can give and certain medications we can avoid giving during surgery to help reduce your chances of having postoperative nausea and vomiting. The second reason is poor pain control. If you still need IV pain medication, then obviously you can't go home that way. Again, that's pretty rare for patients to have poor pain control, so much so that they need to be admitted to the hospital. And then the third reason is your body's just processing the drugs from anesthesia slower, and your respiratory rate or your oxygen saturations aren't high enough to send you home, and then it's safer for us to admit you, so we do so. The second question is, what is the recovery time? So this will vary for everybody, but I would say on average 2 to 3 weeks. After surgery, you're going to feel pretty exhausted. There's obviously pain associated with surgery, and most women are taking narcotics or some type of stronger pain medication for 1 to 2 weeks after surgery. After that period of time is done, there are still some women that'll take ibuprofen and Tylenol for up to a month after surgery. The third question is, will I need help around the house after surgery? And the answer to that is almost certainly yes, especially if you have young children. Things that seem routine and seem like they don't require much effort now will seem exhausting and require a Herculean effort after a mommy makeover. So we do suggest that either a spouse, a significant other, a close family member, or friend be there to help you out, especially if you have a young family, for at least 2 weeks after surgery. The fourth question, how long will swelling last after the procedure? So many women are excited to see the results right after surgery, and to some extent, some of the result you can see immediately. However, because of the surgery, there is tissue swelling that occurs, and this can actually take about 6 months to a year to completely resolve. So it can be frustrating to have to wait that time for that swelling to resolve, but in the end, it's worth it. The fifth question is, when can I return to normal activity? And so this question normally centers around like, when can I return to exercise? Well, depends what you do to exercise. If you run, you're probably going to be waiting at least a month before you go back to exercising. If you lift weights, that is kind of a hard and fast restriction, especially after a tummy tuck or a breast augmentation. We're not going to want you lifting more than 5 to 10 pounds for about 4 weeks to give your incisions time to heal. Women also want to know, when can I go back to work? And again, it kind of depends what type of job you do. So if you do mostly a desk job and you could work from home, it's conceivable that you could go back to work 2 weeks after surgery while working from home. But for example, if you're a nurse and your job is fairly physical and you're lifting patients, it's going to be more difficult for you to go back to work if you're not on light duty for probably up until a month after surgery. Women are often really concerned about lifting their young children after surgery, since the weightlifting restriction is 5 to 10 pounds. We know that, you're only going to have help around, especially if it's a family member or friend coming in to help you with your family for so long. I think at the 3rd or 4th week, if you need to start picking up your child and you do it carefully, then that's probably safe and realistic. However, you do want to minimize the amount of times that you need to do that. Some women are so nervous about this that they just wait until their child is a little bit more self-sufficient and doesn't need to be lifted up quite as often before pursuing a mommy makeover, and that just kind of takes that issue out of the equation. The 6th question is, should I quit smoking before my mommy makeover? Absolutely. This is not a surgery for anyone who smokes. The complication rate is just simply too high if you do smoke. So we do recommend that you stop smoking 4 weeks before the procedure, and then you continue smoking cessation for 4 weeks after the procedure. Now, this includes not only cigarette smoking, but also vaping, chewing tobacco, basically anything with nicotine that's going to cause blood vessels to constrict. So that's including, Nicorette gum. If you're trying to quit smoking, it still has the nicotine in it, which is actually the chemical we're concerned about with causing complications such as poor circulation, which can cause wound healing issues, infection issues. With breast implants, it increases the risk of capsular contracture. So hopefully surgery will just be the impetus to stop smoking completely, because we all know that's, what's best for our health. The last question is, who is certified to perform a mommy makeover? And so we all know that there are different types of doctors, and we all go to medical school. And after medical school, you choose what specialty you're going to spend time learning more about and becoming an expert in. And for plastic surgeons, that's plastic surgery. Now it's most common to undergo the type of training I did, which is an integrated plastic surgery program, which means that after medical school, for 6 years, you focus on plastic and reconstructive surgery related procedures. Abdominoplasties, liposuction, breast augmentations, lifts, all the procedures I mentioned are types of plastic surgery. And so those are procedures that I am trained on formally. So you should only choose board certified, which are my partners, or board eligible, which is me, which means that I'm going through the certification process as I'm younger in my career, to do any type of cosmetic or plastic surgery. You will see that there are some cosmetic surgeons that are not plastic surgeons. And so you don't have to be a plastic surgeon to be a cosmetic surgeon. You could be a family doctor and be a cosmetic surgeon. They don't have any formal training in surgery, but they've taken weekend courses or may have learned sort of informally how to do these operations. It may be tempting to enlist these cosmetic surgeons instead, because usually their fee schedule is cheaper, but it's really the best for your health and safety to choose someone who's trained to do what they do, because as I like to tell women all the time, cosmetic surgery is real surgery. It's no less serious than having your gallbladder out. So who you choose should be a process of meeting with the surgeon, verifying their credentials, and making sure you're completely comfortable with that surgeon and the facility they're operating in. So I hope that was helpful for you guys to go over some of the top questions that most people have during consultation. If you have any questions, please drop them in the comment box below. You can also link to our website, which is also listed below. We'll be releasing more videos on Mommy Makeover, so make sure to like and subscribe to this video if you like what you see. And again, thank you so much for listening in. I hope you have a great day, and we'll see you shortly.